Thank you, Mr. Chair. First of all, I'd like to say, as someone who will not be returning to Congress, it's been an honor to serve with you. I also appreciate your diligence on examining this important need that we have, which is to make sure that we have electronic health records shared in a way that all physicians and healthcare providers will be able to exchange this information. The Chair laid out the benefits of health IT in terms of the money that could be saved by eliminating duplicative testing, and also how health IT could help improve the quality of health care, especially with diabetics. There have been studies that have shown that when electronic health records are used, diabetic patients are able to manage their disease more effectively. Now, the Chair mentioned his concern about the value of the incentives payments, and I acknowledge that our goal is to spend approximately $20 billion, I believe, by 2015 on these incentive payments. I think they're absolutely critical, because if you look at the fact that most Americans get their primary care from offices that have 5 or fewer physicians, these small offices, they don't have the money or the resources to be able to set up a health IT system, especially when those physicians may not be sure if that system is going to really work in an interoperable way, or if it could become obsolete in a short period of time. So I believe it's critical for us to move forward on the full implementation of this platform. I look forward to speaking to the National Coordinator about his work with NIST, since the HITECH Act directs a partnership, or I should say that this rule that we are now reviewing establishes a partnership which would help further develop a health IT platform that could result in the interoperability of electronic health records. My one closing statement is this, is that even though this area is complex, because the healthcare industry is complex and health IT itself is complex, being able to have these records in an electronic form that could be shared can make a difference. 2 months ago, my first cousin, the closest blood relative I have here in this country, who's younger than me, passed away. She suffered organ failure, and my belief that combination of prescription drugs may have been a contributing factor to that. It's likely that with these electronic health records, we'd be able to identify that type of prescription drug interaction before it happens. So with that, I yield back the balance of my time.